Hey guys, Steve Morales here, and today I'm going to do a quick video on some movements that you can do, some exercises that you can do for lower back pain. A lot of people have lower back pain, and there are a host of different reasons for that. A lot of times it boils down to just us having a static position for most of our day, so we're not really moving much, regardless of whether that's standing or sitting. It's the fact that we've been static. So, and more specifically with sitting, it's going to create a pelvic tilt where my hips are kind of rolled forward. It's putting a lot of pressure on the lower back. A lot of times I'll see people too, well, they'll stand normally and they'll actually have like an arched back like this, which is putting more and more pressure because everything is so tight. Okay, now I'm not going to cover a ton of stretching. I'll actually show just a handful of stretches at the end that I want you to do, but you've kind of done your warm-up and now you're actually going to do some exercises for this, and this will be some post-rehab stuff that I have some of my clients go through. So I have a stability ball here. I mean, these are $10. You can pick this up at Walmart or off of Amazon or something like that, so it's not super duper expensive for this. So you will need one of these, and if not, I mean, the thing that we're going to be using this for, you can do it without it. It's just this is going to give more support to the back, which is why we want to use it. So first thing that we're going to do is actually just toe taps. Okay, now there are multiple levels to this, but I want to lie on my back, and with this I want to find neutral spine. We've got two different definitions. The first one is typically when I'm sitting here, I might have a spacing where I could put my hand underneath my back. I want to actually flatten that part of my back out. So that's the first definition. The second definition is finding the position that is comfortable for you. Some people might have an injury or something like that going on where they can't, like this may feel like not necessarily super duper uncomfortable, but it might actually be painful. So you have to find that position where the spine isn't in pain, okay? So, first definition, flatten the back. From there, if that's too much, like I said, find that position that feels good for your lower back, okay? From here, hands will be flat on the ground. I'm going to bring my legs up like I'm kind of sitting in an invisible chair, okay? With this, I want my feet relaxed so you don't see my feet tight like this, because that's going to tighten everything all the way up my leg, and then it's going to tighten my lower back. So, here, relaxed, keeping, and you want to maintain that neutral spine the whole time. All I'm going to do is let that leg drop down, that toe is going to tap the ground, and then I'm going to come back up. You can do this, typically I'll have people do this alternating. You could do the same side, but alternating is usually a little bit better. Go back and forth. There you go. And when you do this, what you should feel is that your stomach is bracing. It's stabilizing your spine so that when I go down, my back doesn't arch up. Right? It doesn't leave that neutral spine position. So not only will I feel my abs, right, here, I'll kind of feel it come at an angle, and I'm going to feel this erector over here too, part of my lower back, fighting to keep that position. So this is kind of like a level 1 thing that we might do. If I'm doing better in this position, I might let my leg actually like drop out, and I might like tap my heel out here, and then pull it back, and I can progress further and further in that. So you can slowly scale that. If you want more of a challenge, you can actually do what's called a dead bug, where I'm here now, my arms are up, and that opposite arm and leg would go out, and then I would come back up to center. Typically with this one, what you'll see is somebody goes to do this movement, since it's a contralateral pattern, they'll like kind of like shift the knee in and the other arm in at the same time because their brain's getting a little bit confused. So slow the movement down. Don't rush through this. So that's kind of our first exercise that we want to do right there. Like I said, scale as needed. Reps, 10 per side. Regardless of which one you're doing, we want to do 10 per side for this. And if you get to the point where you're doing toe taps and then the 10 feels super easy, that's when we can start to progress. And you might need to do lower reps, right? Maybe you can only do 5 per side, and that's totally fine. Or I might have people that can do 5 of the heel taps per side, and then they need to switch back into doing toe taps. So that's totally fine too. Now this is where the stability ball is going to come into play. This is the second exercise. And we're going to do alternating arm and leg raise, okay? So for this, I'm actually going to fold over the ball. And the reason I'm going to do this is actually going to give support to my spine, right? It's actually going to give internal pressure so that I'm not collapsing my back. The other version of this is just like a bird dog or an opposite arm and leg raise where we're here, right? We're going to be going out like this. Now, if I don't have that stability ball, this is what I can do for that, right? That opposite arm and leg raise. Big thing here is making sure that the hand is underneath the shoulder, knee is underneath the hip. But in this position, sometimes what will happen is somebody go to do this, and they'll actually like arch their back, and they'll put a lot of pressure on it. So that's why it's good if we have the stability ball, because with this, if I'm lying over it, it's a little bit harder to do, and I can scale it a little bit more, okay? So if I'm here, the scale is, if I want to make it easier, okay, I can bring my hands in closer to my body. If I want to make it harder, I can put them further away. I can also put them wider apart, okay? If I roll up here, this is going to be harder, right, to stabilize that. Versus if I'm down here like this, it's going to be easier, right? So we have the scale going forward and backward, right? And then with our hands and our feet in the position that we put them in. Now, typical position is just right, kind of dead center. Hands are out a little bit. You can raise up here, come back down. Now, big thing I'm going to notice is the glute firing, but what I'm going to feel is that glute all the way across up to that opposite shoulder that I'm raising up. Like I said, this is a contralateral pattern. Opposites are moving together. What you may notice, and this is where this comes into play with stability, is that as you're starting to do that, especially if you have like a hip weakness or a glute weakness, you'll try and like roll to one side. So I'll be up on the ball, I'll go to raise up like this, and I might shift one way or another, okay? That's where you need the most work. So keep that in mind when you're doing it. Scale as needed, okay, based off what's comfortable for you. Same thing, we're just gonna do the 10 per side, right? So nothing super crazy with that one. And then you could always progress. Like I said, if you don't have this, you could do the bird dogs, opposite arm and leg raise without that. Just be mindful of not arching your back in the position when you do it. Now, last one we're gonna do. Crunch, just a basic crunch. Just building strength with the core. Now I'm using the ball to rest my feet on so that I can actually get into neutral spine, right? Much easier, and then I can relax into the position. So I'm not trying to fight it. But even with this, some people still try and arch their back. So be mindful of that you want to flatten it out. Hands back behind the head. And I'm going to come up towards the ceiling. It's a very short movement here. Back down. Like I said, very, very short. I'm not trying to come super duper high. I could, but if you have a back injury and you're doing that, you're most likely putting too much pressure on your spine and the discs, so you're going to feel pain when you come up. Don't need to do that. Short movement here, up, down. With my hands, they're interlocked back behind my head, and this is dead weight. So I'm not trying to strain my neck doing this. And my arms aren't just pulling my head up. They're just there to create the platform so that I'm not using anything to assist the movement, right? My shoulder blades come up, my abs pull and do that, and then they go back down. Now this one we're going to do higher reps. We're going to do 20 to 30, okay? Good squeeze at the top, and then back down. If I need to scale that and it's too much initially, I can always drop that back down, but slowly try and increase that, okay? And eventually, the scale would be that I wouldn't have this ball. I could actually just take my legs here, and then do right here. Okay, so there's a scale with that. Same thing, most likely going to be sticking with 20 to 30 reps, progress as needed, okay? And you can always split it up if you want to. Maybe I do 10 without the ball, and then I need the ball after that, okay? As far as stretches, big thing is making sure that you're stretching the hamstrings, right? So one leg in, one leg out, grab out here. We're gonna hold 10-15 seconds. You'll do both sides, butterfly stretch. Another one, a good one could be a figure 4. This leg here, shin box, foot stacked on top of the other one. I'm probably going to need to assist my hand here. And then I can actually kind of rotate a little bit. If it is a back injury, you're probably not going to be rotating, so just kind of getting to this position might be hard enough. And the big thing is going to be trying to loosen up the hips so that they're not pulling on the pelvis and creating that anterior pelvic tilt, okay?
I have another warm-up video that has a lot of other good stretches in it. The only other one I really want to cover is kind of the cat-cow, which is here, where I'll take a deep breath in and I'll pull in like that, right? Same thing though, hand underneath the shoulder and knee underneath the hip. I'm going to go that way. So, breathe out, hand that backwards, breathe in, arch the back, look up towards the ceiling. With this, you're going to create a breathing pattern. I mean, I give clients 3, 4, 5 seconds, whatever it's going to be, going into one position, holding 3 to 5 seconds, and then go into the other one, holding 3 to 5 seconds. Between that, your hamstring stretch and your butterfly stretch, and then your shin box or your figure 4, you should be good. Most people that truly have really bad back problems, initially, they're not going to be doing cobra pose or upward facing dog, whatever you want to call this one. They're not going to be doing this. It's too much tension, okay? So if you can, awesome. If not, don't worry about that last one. And that's a pretty basic yoga move. Most people end up knowing that. So if you guys have any questions or comments or anything like that, or anything else that you want to see, just post that below, and I want to thank you guys for watching.